Hello, everyone. I'm Kai Deng. This is my assistant. His name is Yu Xiangchen. He is holding the cameras. We are from the Department of Gastology and Hepatology, West China Hospital, Sichuan University. Our article is Long-Term Outcome of Local Resection versus Surgical Resection for High-Risk T1 Colorectal Cancer, a systematic review and meta-analysis.
Why did you feel a need to do the study?
With global agents, the population of elderly patients is currently increasing, and the elderly patients have more complex underlying disease and were generally in poor condition. And what are the specific benefits of additional treatments in the short, medium, and long term? Therefore, it's important to clarify the difference in survival risk between additional surgery and no additional surgery in this population, so as to provide the individualized treatment plan for the elderly patients. Therefore, we did these studies for two main reasons. Firstly, at present, most guidelines recommend additional surgery for T1 CRC patients with high-risk histological factors after a non-curative endoscopic resections. However, there are some special populations, such as patients with advanced age and severe disease, who are at increased risk of surgery-related injuries and deaths compared with other patients. What's the benefit of additional surgery for them? Second, quantifying the short, medium, and long-term benefit of local resections and additional surgical resection is more helpful for clinicians for making more individualized treatments. For example, in an elderly patient with heart and lung disease, the medium-term benefit of additional surgery may not work. It should be taken into account whether to prefer additional surgery.
What does your study add to existing knowledge?
Currently, the guideline recommends the high-risk T1 CRC patients undergo surgical treatments due to their high risk for developing resident cancer and lymph node metastasis. Nevertheless, more risk factors have been analyzed in only retrospective studies, and the long-term outcome according to the acute risk for lymph node metastasis, recurrence, and disease-specific disease in high-risk T1 CRC patients remain unclear. Thus, selecting a suitable stratagem for high-risk T1 CRC patients is a clinical challenge. Importantly, the outcome of our meta-analysis may help the clinicians to quantify the net benefits based on the acute risk and make individualized decision for high-risk T1 CRC patients. In our study, the poor overall survival was significant first in the local resection group, in the surgical resection group, over 5 years. The result of recurrent rates were similar. However, no significant difference on poor disease-specific survival was not observed until a follow-up period over 10 years. It means that the benefit in high-risk T1 CRC patients from surgical resections may emerge 10 years later. In shortly, the most important thing is that we found that among high-risk T1 CRC patients, the net benefits in disease-specific survival between local resection and surgical resection did not emerge until 10 years later. It implies that The net benefits of additional surgery resections take a long time to be realized. In some patients who have severe disease, it's difficult to wait this long time. Therefore, local resection may be a reasonable alternative for individualized treatments in some high-risk T1-CRC patients.
What should come next?
To our knowledge, it is the first meta-analysis that compare the long-term clinical outcome of local resection and surgery resection in patients with high-risk T1-CRC. Therefore, our study included only a high-risk populations and was more touched to address the clinical problems. But these studies also have some limitations. Since articles included in these studies was all retrospective studies and the number of cases was small and some missing dates, its credibility needs to be verified. It helps that in the future, more and more researchers can pay attention to these directions to provide more case number for exploration. Finally, our conclusion is that, in summaries, for high-risk T1-CRC patients, net benefits of disease-specific survival appear to be significant when observation period exceeding 10 years. A long-term net benefit may be exist, but may be unsuitable for all patients, especially for high-risk patients with severe comorbidities. Therefore, local resections may be a reasonable alternative for individualized treatments for some high-risk T1-CRC patients. That's all. Thank you for your listening.